The first thing I need to do before starting an assessment is to build rapport with the patient. Introduce myself, explain what I will be doing, ask what brings them to the hospital, and address any question they may ask before I begin. I perform hand hygiene and observe the other appropriate infection control procedure. I bring all my requirements to the bedside and provide privacy to my patient. First, I obtain a general overview of the patient's health state, such as collecting their vitals, check heart rate, measure blood pressure, take body temperature, pulse oximetry, respiratory rate, level of pain. I check their height and weight and also calculate their BMI. Once I have a general overview, I can start from the top of the body and make my way down to inspect the shape and symmetry of the head and face, to palpate the scalp for tenderness and masses or lesion. For the eye, I inspect the external structure of the eye, including the eyelid, conjunctiva, and sclera. For nose, I inspect the external nose for symmetry and abnormalities. I also palpate the nasal passage for tenderness or masses. And for the ear, I inspect the external ear structures. For mouth and throat, I inspect the oral cavity, including the lip, tongue, and tonsil. For neck, I inspect the neck symmetry and abnormalities. I also palpate the neck or lymph node masses or tenderness. I assess the range of motion of the neck also. And for the chest and thorax, I inspect the shape and symmetry of the chest, palpate for tactile parameters. I auscultate the breath sound and heart sound, and percussion to assess lungs density. And for the abdominal cavity, I inspect the shape and symmetry of the abdomen. I auscultate the bowel sound, percussion to assess abdominal density, and I palpate for tenderness, masses, or GERD. I document my findings and continue with the assessment. And for the upper extremities, I inspect, palpate, and assess the range of motion of the shoulder, elbows, wrist, and the hand. And I also assess the strength of the muscles in the upper extremities. And for the lower extremities, I also inspect, palpate, and assess the range of motion of the hips, knee, ankles, and feet. I also assess the strength of the muscles in the lower extremities. I check for the pulse in the lower extremities, that is posterior tibial pulse. And for the back, I inspect the shape and symmetry of the back. I also palpate the back for tenderness, masses, or lesion. I assess the spinal alignment of the spinal cord for any abnormalities or deformities, and also inspect the coccyx and buttocks. I thank the patient, ensure comfort, clear away the equipment, and document the procedure and any observation made.